Assalamualaikum everyone, I hope all of you are doing well. In this video I am going to talk about on the 3D anatomy of the clavicle. So before discussing the anatomy of the clavicle, there are some features that are specific to the clavicle, and I am going to tell you the features of the clavicular bone. So the another name for the clavicle is the collarbone, and it is the only long bone that lie horizontally in our body. This is the only long bone that lie horizontally in our body. You can see over here. So, and it is the mostly fracture bone in our body. It's about 6 inches long, which is about 15 centimeter. So going to the anatomy of the clavicle, you can see over here it has got the two ends. One end is here on the lateral, and the other end is here. This is the medial end of the clavicle, and this is the lateral end of the clavicle. You can see over here. This medial end of the clavicle is also called the sternal end, and this lateral end of the clavicle is also called the acromial end. So you can see over here, this medial end is little bit quadrangular. It is quadrangular, and this lateral end is flat from above downward. You can see over here it is flat from above downward. So this medial end is articulated here, rubrum of the sternum. So this is articulated here through a facet. This facet on the medial end of the clavicle is called a sternal facet, and here there is a facet on the manubrium of the sternum. You can see over here this facet is called a clavicular facet. So this form a joint. This joint is called a sternoclavicular joint. Now the lateral end or the acromial end of the clavicle has also got a facet. You can see over here this facet is articulated. This is the acromial process of the scapula. You can see over here, and it articulated here. In this case, the clavicle is articulated here through a joint which is called a acromioclavicular joint. Now you can see over here the scapula is divided into three regions. One is the medial end, the other is the lateral end, and this is the shaft of the clavicle. The medial end and the lateral end I have discussed, while the shaft of the clavicle I am going to discuss the anatomy of the shaft of the clavicle. So the shaft of the clavicle is about 6 inches long, and it has got the two regions. One is the medial two-third. This is to see the medial region of the clavicle. It is the longest. You can see over here it is the longest, and it is narrow, and it is thick from above downward. You can see over here it is thick from above downward. A groove on the inferior surface of the medial region of the clavicle. This groove is called the subclavian groove. It provides insertion to the subclavian muscle, and there is another impression here on the inferior surface of the medial region of the clavicle. This impression is called a costoclavicular ligament impression. It provides attachment to the costoclavicular ligament. The border is convex anteriorly. You can see over here it is convex anteriorly, while the posterior is concave posteriorly. You can see over here it is concave posteriorly. Now going to the lateral region of the clavicle. The lateral region forms the 1/3 of the shaft of the clavicle. It has got the two surfaces. One is the superior surface, the other is inferior surface. You can see over here this is the inferior surface. There is a line that goes on the inferior surface of the clavicle. This line is called a trapezoid line. This is the trapezoid line. I am going to zoom it. This line is called trapezoid line. Inferior surface of the lateral 1/3 of the shaft of the clavicle. There is a tubercle. You can see over here. This tubercle is called a conoid tubercle. Now, if you see the lateral region of the shaft of the clavicle. It is concave anteriorly while it is convex posteriorly. You can see over here it is convex. You can see over here it is convex posteriorly. This is the opposite of the medial two-third of the, and this is the opposite of the sternal region of the clavicle, which was convex anteriorly and concave posteriorly. Now the area around here provide attachment for the capsule of the acromioclavicular joint. Now what are the function of the clavicle? There are three main functions of the clavicle. It provides a rigid support from which the scapula, this is the scapula, and here the upper limb is here. So it provides a rigid support from which the scapula and the upper limb is suspended. Now if you see the clavicle is attached here to the scapulothoracoacromioclavicular joint, and to the scapula the humerus is attached. Just keep upper limb away from the thorax, so it provides a greater range of movement to the upper limb. And the third function of the clavicle is it transmits the physical forces from the upper lip to the axial skeleton. In the axial skeleton and the appendicular skeleton I have already discussed it, and you can find the link of these two videos in my description of this video. So this was all about on clavicular anatomy. For more videos, subscribe, like and share. In the next video we'll discuss the sternoclavicular joint and the acromioclavicular joint. So thanks for watching the video.